future of the NHS is completely dependent on an effective primary care service. That's going to deliver prevention, and it's going to mean that we can achieve much better value for our populations. Key to that is going to be general practice delivered at scale, collaboratively.
I also think for practices, for general practice to really be this core component of the transformation of the NHS, they need to be working together, they need to be working collectively, they need to be learning and sharing and having that collective voice. And I think by working together, they can achieve so much more than they can do by lots of individual units. And I think that's something that we as commissioners really want to support.
In 2014, Southwark CCG secured funding from Guy's and St Thomas's charity to support primary care development. The resulting programme has centred on the development of a cohort of general practice emerging leaders who have played a central role in developing neighbourhood working and transforming primary care locally. This has included the development of local GP federations, covering groups of practices in the north and south of the borough, and the delivery of increased GP and nurse appointments through extended access clinics operating 8 a.m. to 8 p.m. 7 days a week. The leaders have also been engaging their peers in general practice and wider primary care, as well as other health, voluntary and social care partners to support wider system transformation and integration.
Well, we know that this way that services are going to be commissioned in the future is very different. The sort of bureaucratic boundaries between primary care, secondary care, between social care, mental health, the voluntary sector, those boundaries are dissolving.
I think there's two parts to the vision. I think firstly, it's about not being so head down in our individual practices, but actually working with our neighbouring practices to deliver services more at scale and more equitably across the whole patch. And then I think it's about making sure that general practice is right at the heart of the local care networks and forming really good, strong, integrated relationships with the other providers in our area, the voluntary sector, social care, the main hospitals, so that we can work together to improve patient experience.
Historically speaking, there's been a lot of differences in the level and quality of care. And by working together, we can share resources in order to give a much better quality of care for our patient. And I see general practice as being the key player in being able to do this.
I suppose my vision of where general practice will be in the next 5 years is at the centre of a more coordinated system with the patient as the focus and us arranging services with other providers, working with other providers to provide a high quality service to patients within that system.
Over the past 12 months, the key achievement has been the consolidation of our federations in Southwark. It's been quite hard work, but we're working really well with all our practices now. We've engaged well with the practices. And we are now we've won contracts to deliver services as federations. So the new extended primary care service, the south started in November and in the north we started in April. Service is going really well. It's a completely new thing. We've never delivered services in this way. It's getting better. There were a few glitches at the beginning, but now practice are referring in. Patients really like it. The feedback has been really positive.
I feel like it's an extension of my own surgery, and I hope that in the future other surgeries will start using the services more like an extension of their own surgeries.
I think we've been really fortunate in Southwark and across Lambeth to have the investment from the GST charity, recognising the importance of developing leadership in primary care. And I think without that we would have not achieved as much as we have.
I think the main challenge for us is going to be working with the complexity of the system and the transition from where we are now to where we want to get to.
We have to take the federations to the next stage now, so it's not enough just to have been working together, but we now have to be a corporate functioning organisation, and that will be a challenge as well, because we have to retain the practice willingness to be a part of that as well, so it's quite a transformation.
General practice is a really hard day job. Actually, at the end of the day, it's quite difficult to come home and think about the bigger picture and think about how I could work differently, because actually just keeping yourself afloat is quite difficult. And that requires lots of people to get engaged with the federation and lots of people to work together.
What I'd really like to see is us working closer together and sharing our resources so that we can work in a much less stressful environment and deliver better care for our patients.
I'd like to see general practice as an exciting and rewarding place to work, but as part of a much bigger integrated system, which makes it easier to deliver services, but also makes it a much better experience for patients.
We're at the beginning of a journey on this, and I think the federations, there are so many opportunities that I think they will be thinking of and considering and looking at ways going forward. So I think we as commissioners need to be really attuned to that and listen and discuss that with them.
We know that the transformation programme that we're just beginning is not just about general practice. What we need is general practice to have a seat at that table and to contribute to the conversations that are taking place about how we're really going to deliver care outside of the acute hospital setting in the future. That's going to require a much more multidisciplinary approach, and we really need effective leadership from general practice in starting to help us develop the ideas that we have so that the care that patients receive in the end will really work for them.